as we're dealing with a 15% revenue loss, and we're trying to redesign at the same time. And then we have these, hundreds of millions, billions of dollars of projects that we've done over the years that becomes a debt burden. How are we going to juggle that?
I think we've got to stop the addiction to capital and the addiction to growth in healthcare, right? If you look from an industry standpoint, healthcare has one of the lowest sort of returns on invested capital. We create these facilities and locations, and then they're grossly underutilized in most cases. And that was all driven by this addiction to growth and the fee-for-service environment I call kind of the golden goose. The more you do, the more you make. And like the golden goose, we're killing it because our employers and our country and our GDP can no longer pay for it. So I think and this also becomes a cash conservation method, right? By reducing new capital projects and the cash consumption that's related to them. So this is no longer about growth. The capital needs to be spent on transformation. So how do we look at our existing facilities? What can we do to increase the throughput of those existing facilities? How can we consolidate? So it's actually fewer physical locations. How do we close? I can't say outright hospitals, but that may even be the case for a large system. But how do we close physician offices? How do we close surgery centers to increase the volume and the throughput of the existing remaining facilities? So capital will need to be redeployed in a way which delivers productivity and efficiency and lowers cost, as opposed to providing capacity for additional volume or amenities for patient experience.